Okay, 2 neck exercises for today. The first one being a resisted stretch, a so-called positional isometric, sometimes referred to as a PAILs effort contraction. Okay. Second exercise, neck CARs, controlled articular rotations, during which time we're going to attempt to move the neck through the largest range of motion that we can. Okay. Beginning first with those positional isometrics, our goal is to first identify where throughout our neck range of motion do we feel the largest amount of stretch and tension. Okay, so for example, if I tuck my head down toward chest, opposite armpit, and I feel quite a strong stretch and tension along this back right side, I've now identified where is that strongest stretch tension. That compared to, for example, going straight down, going to the opposite armpit, bending back over the shoulder. Step one in that sense is kind of an investigation. Where do I feel this stretch and tension? So if I feel it here, I'm going to come to this position. I'm even going to give myself a little bit of help in the stretch with one of my arms, one of my hands, and I'm going to pull into that stretch only so far as I am perceiving still no pain. Once I'm in that deep stretch, my goal is going to be to hold the position for a minimum 60 seconds, ideally 90 seconds or more. At the end of that 60 to 90 seconds, I'm going to resist the stretch, which is to say I'm going to push my head back into my hands, as though I'm trying to push the head back to a neutral position. Now, when I begin that resistance, I'm not doing so with all the force that I can generate. In fact, I'm going to start with a very light resistance, say 10% of the force that I could generate. I'm going to slowly increase how hard I'm pushing my head into my hands there, as I do not want to exceed a threshold that may provoke any pain. That means that if I get to say 50% effort, but I go to 60, and at 60% I feel some pain with the resistance, I've gone too far. I'm going to stay at 50%. Conversely, if I can go to 80% and I feel no pain, great, do it. But if at 90% or some higher effort threshold, I start to feel a pain reaction, I've gone too far. Okay, so the rule is never any pain when we do this sort of training. So, again, in summation now, find the stretch. Hold the stretch for 60 to 90 seconds, then we begin the resistance phase, or what we call the PAILs. With the PAILs, I'm going to start 10% effort, pushing my head back into my hands. Then 20%, 30%, 40%, 50%. Let's say if I go any higher than 50%, I feel pain. I'm going to stay at 50%, and I'm going to maintain constant 50% resistance for a 15 to 20 second hold. At the end of that 15 to 20 seconds, I'm going to slowly release the tension and comfortably bring my neck back to a neutral position. Now, it's very possible that we're going to feel that tension, not just, as the example I did, chin down toward armpit. Maybe I feel a strong tension to the side. Maybe if that's you, then we're going to need to work those PAILs from this position as well. Maybe I feel it when I go the opposite range of motion entirely, sort of ear over shoulder. In that case, the resistance is coming from over here. Maybe I feel it when my head goes straight back. The resistance is coming forehead into hand there. Ultimately, the resistance from the hands into head is going to be effectively opposite whatever direction you've moved your head and neck. Okay? Now, exercise number 2 are neck CARs. Goal here being move the head and neck through the largest range of motion that we can. Again, rule number 1, no pain though. Okay? So normally a neck CAR would look like this. We're going to flex the chin slowly toward the chest. Imagining as we flex down, there are 7 bones in the neck. I want to feel like each bone is moving kind of one over the other as we flex forward. We want to feel what's defined as segmental motion. So, segmentally flexing my neck, chin down toward chest until I'm in maximum neck flexion. I'm then going to rotate as best I can about an axis till I've reached the end of my rotation. I'm then going to laterally flex, moving in this case, my left ear over my left shoulder. Then begin to transition to neck extension, where I'm going to draw a line across the ceiling with my chin until now my right ear's over my right shoulder. I'll tuck the chin down toward the shoulder and then drag the chin back across toward the middle. I can reverse the motion, starting flexion, rotating to the right, laterally flexing to the right, extending, laterally flexing, rotating, back to neutral. We're going to program this for probably 3 to 5 repetitions per side, provided it's comfortable. If we're noticing, for example, during the phase when my right ear comes over my right shoulder, if I feel a pinching-like sensation someplace in the neck, often sort of experienced in joint pain scenarios, I don't want to move so far into the range of motion that I provoke that pinch experience. Which is to say, rather than bending as far as I can that way and feeling a pinch, maybe I'm going to bend just a little bit less. I am always staying within pain-free thresholds. The justification being that when we send good movement information from our body up to our brain, we're more than likely going to get sort of good sensation from brain out to body. Okay, we want to send only positive signals, if you will, toward the brain, rather than potentially provocative signals to the brain. Okay?